Two, three. Well, hello everyone. Hello, 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 hello. I always say that hello, hello. But anyway, guys, welcome to meet Tina. Just so thankful to have all of you, come and watch my channel here. And today I'm just excited. I'm excited because I'm into not just, talking about body and the mind and spirit, but also I want to bring more speakers who can talk about how to, take care of your body. And today I got Travis Field. Some of you may remember him. He came in here once and talked about facial reading, and he did live facial reading. And I'm telling you, it's amazing. If you guys have not seen that video, please look at that video. He's amazingly accurate. And after that talk, he got so many people contacting him. It's just amazing. That's how well-rounded and how educated and how good he is at doing this. And so today he's going to be talking on a different subject. It's about the neuromuscular therapy. So let him talk about it and tell you guys exactly what it is, which I think is very, very important for everyone to know exactly what it is and to be able to utilize it and also share what he's been teaching as well, which I think is quite fascinating. So let's welcome Travis Field. Hello, Travis. How are you doing?
Hey, Tina. Thanks for having me. You'd be a great campaign manager. I should hire you.
There
Thank
you
you for
go.
that really
You're
wonderful
hired.
introduction.
Thank you. Thank you. So Travis, a little background about you, because some people may know you just being a facial reader. That's from ancient that you learned from your teacher for many years from China, I think. You learned from like direct source, and you're so good at it. But I know you're also a neuromuscular therapist, and you're also a teacher. I know you're very good because you taught me some technique, when I graduate, and I'm like, God, this guy is great. So
Oh,
let's
thanks,
dive
Tina.
into it. Yes.
Yeah, that was my neuromuscular therapy was my first modality, I guess you could say. I was in finance before and I didn't like it. So I went into massage school. I actually really wanted to be a personal trainer because I love nutrition and I love fitness, but I was so skinny, I thought, no one's gonna want to train with someone who looks so thin. So I said, okay, I think I heard somewhere like on one of the forums that massage therapy would be a good adjunct to like personal training. So my plan was, to get built during massage school, and that didn't happen. But when I enrolled in massage school, actually, I took a tour at National Holistic Institute, and when I went there, I remember Candace, who was at the time a teacher. She was talking, and she gave this really passionate speech about the body and how impactful like massage can be. And I was like, wow, I think I want to enroll in this. So I did, and I took the core program, and it was great. And that's where I got my introduction to Eastern medicine, because there's just a little bit about like shiatsu and five elements in Chinese medicine, which I thought was really interesting. And I did the Swedish part of the core program where we learned the basic anatomy, but it wasn't until I got into the neuromuscular therapy program, which at the time I didn't really know what that was. I just knew that I really enjoyed being in school because I didn't realize how powerful body work could be. And even during that time, it really corrected a lot of my own issues. And I thought it was just by accident or just by fluke until I went into this neuromuscular program where all of a sudden it became this very clinical application of body work. So most of the time, I think when people are going to get a massage, they just expect something general that works on the whole body and then they go to sleep. And I think that's really valuable. And I think too often times people that don't do that kind of stuff, they kind of they don't really see the value in it, but I do see a lot of value in that. But the neuromuscular stuff is really, really powerful because it's a little bit more close to the kind of work that a physical therapist might do or a chiropractor might do or even an osteopath. But ultimately too, it's interesting because they aren't as focused on manual work. So it's really this unique style of body work that's highly specific based off pain patterns. So it's really focused on treating pain in the body and dysfunction.
Exactly. Exactly. I have to agree with that because, oftentimes people do not realize how important massage is because they have experienced like a spa massage, which is more like a Swedish massage. And that's for relaxation in general. But this type of neuromuscular therapy work, Travis, I've noticed that it actually have healed a lot of people who's going through a lot of pain, right?
Yeah.
So can you kind of dive into the complexity of this work. Like, why is it? I mean, I would call it medical massage if we're allowed to do that, right? But we're not allowed to call it medical. But it is, to me, is really a true healing body work that everyone should get. So would you kind of dive into a little more deeper into this subject? What does this do to the body? And what
Sure.
does it heal?
But yeah, it's so interesting to me because it's been a while since I've been in school, to be honest with you. So like I'm not so on top of all my anatomy and my scientific terms. But
Yeah.
I will tell you, the definition of a trigger point is this hyper irritable, hypersensitive top band of muscle tissue that is overly contracted. So basically, if we are living our lives doing the things that we do over and over and over again, and our body doesn't like it, it all of a sudden creates it's almost like a kink in the hose where the muscle tissue gets really tight, but it also gets really weak because there's not the proper circulation of blood and nutrients and, circulation in that area. So what happens is with these trigger points, they're basically points of injury in the body, and from my understanding. And because they are points of injury, if they're left ignored for too long, they can tend to cause a lot of havoc and issue and pain. And I think there was this study that came out that showed 80% of the people that go to the doctor's office for pain, they have muscular pain, like musculoskeletal pain. So one of the nice things about this kind of body work is that if someone has musculoskeletal pain, it can be treated by this kind of work, which is great. Because a lot of the times I think people, one of my favorite sayings is that you don't feel pain because of your age, you feel your age because of pain. And I think that's so true because so many people think that they're getting old, think that their bodies are broken, and it's actually not that, I don't think. I think that in reality, they're just being asked to go in a different way and to not overuse their bodies so much. So neuromuscular therapy is really great at treating issues because there's these pain patterns that have been tracked in the body. And I'd be doing a disservice if I didn't talk about where we learned it from. So I'll just go into that if that's okay. But
yes,
this
please.
work originally comes from Janet Travell, and she was President Kennedy's doctor. Like she was the woman who treated his back pain, and she got like very famous for that because at the time, like he thought he had this excruciating back pain, I think in like the 60s. And he was like so happy with her work that he made her like the chief of medicine for the White House. And she's also the woman who said everyone should get a rocking chair because it helps with low backs. And that's why you see so many elderly women, or like, men, but mainly the women, with rocking chairs because it helps the low back by rocking the musculature to help take pressure off the lumbar spine, which is interesting. My grandma has one, so I kind of laugh when I see that because I know that comes from Travell. And then going down a little bit further, we learned from Cynthia Ribeiro, Cincha, and she was just so incredible. She actually had the opportunity to take classes and study with Travell. And so it was so insanely amazing to be able to have this person who studied with Travell who would say, Travell said this, or Travell said that. And really, like, I give so much of my bodywork credit to her because without that program that she created, we would not know what we know. And I really think that Cynthia changed the game for massage therapists in California. She did so, and probably all over, but she did so much work for us because now NHI, I think, has like, I don't know, seven neuromuscular programs, and like, they're teaching it more and more. So because of that, we're able to have more credibility because now people actually know that massage can help with pain, which I don't think they did before.
Wow, it's so true. And NHI is National Holistic Institute. The one we went to is in Santa Ana, but they also have in 7-8 locations, and they're expanding. And really, I mean, for those who are interested in this body work, I would highly encourage you to check out National Holistic Institute because I agree with Travis. Cynthia, amazing teacher. And I'm telling you, this kind of work can heal a lot of people with body pain, and it's just amazing because I just think that a lot of people need to know more about this kind of work. There's still not enough therapists out there. Am I right, Travis?
Yeah, I'd say so. It'd be good if you got Cynthia on here to talk because she would just blow your brain.
Oh my God. How come we didn't think about that before, right? Maybe next time, next show, next talk show, I'm going to invite her and Travis to come on the talk. I think those of you who have body pain or question about your body symptom, whatever, if you can ask and she can answer, and Travis as well can help you guys out, I think that'd be great to understand more about how important it is to have this kind of body work done. It's not just a luxury or just like regular massage that you get. It is something really, really, it's going to make you feel younger. Like you said earlier, how body pain makes you feel older. And God, I can agree with that. When I got really, really sick a couple of years ago, I felt like I aged 100 years. So this is just quite important to know about that. Now, Travis, you also do other kind of teaching. Earlier, you mentioned about meridian points, and also you do teach a facial reading as well, correct?
Yeah, it's funny. I originally started like learning the neuromuscular stuff, and then I went to go do internship because at National Holistic Institute that was required. So I went to go intern with like so many different kinds of people because I wanted to see what kind of profession I wanted to be in because I was so curious. I was kind of a nerdy student, I was an overachiever. And I remember that I went to who did I go see? I went to go study with a chiropractor. I went to go work with a dentist doing work on the TMJ, like the TMJ and the internal pterygoid muscles. And then I did work with a medical doctor, and then I did work with a athletic trainer, and then I worked with personal trainers, and I worked with so many different kinds of healthcare professionals. And it was finally the acupuncturist that I worked with, and people left her treatment feeling so much better, and they looked different when they left. And I was like, wow, that's kind of cool. So I was like, I think I got to try this. So I booked a session with her, and I tried acupuncture. Nothing. Didn't feel anything. I was like, that was relaxing. That was cool. I didn't really notice the benefit. It wasn't until I lost function in like this hand and the neuromuscular therapy didn't help. It helped a little bit, but it was because it was a nerve issue, which acupuncture is so good at treating. She gave me a treatment because I called her and I said, hey, I can't come in. And she goes, oh, come in. I'll give you a treatment. And she sticks these needles in between my knuckles so I look like Wolverine from the X-Men. And I just feel all this blood rush back to my body, and like I jump like a foot in the air. And I was like, wow, I can feel my hand again. I can feel my hand. So at that time, I started studying, and I eventually enrolled in acupuncture school. And like before that, I studied a little bit of the anatomy trains with Thomas Myers, which are basically the fascial lines. And I didn't study directly with Tom, but like I took one of his classes about like structure and function, which I thought was really interesting. And even in his book, he correlates the relationship between the anatomy trained myofascial lines with the Chinese meridians. But because no one's an acupuncturist or studies Chinese medicine, they kind of just said, well, these are interesting, like we have these kind of correlations, but we're not really too sure about that. So here it is just for you to be, aware of. And anyways, from that point on, and then I realized that I think 70 or 80% of the trigger points that are mapped out in the body, that there's these pain patterns that have these trigger points that actually show, like on every single person that has this pain, you will find that trigger point in that area. Well, those trigger points actually turned out to be acupuncture points, which was really interesting. And if you actually look at the science, because acupuncture is not as esoteric or mystical as it sounds, it's actually about creating blood flow in the body, to put it really simply. All of these acupuncture points or all of these neuromuscular junctions are places where nerves, blood vessels, arteries all intersect. So it's really easy for things to get stuck there. So after like doing some studying, and I went to acupuncture school, I realized that I wasn't so interested in acupuncture. I wasn't so interested in treating illness. I was more interested in learning about the things that I didn't learn there, like facial reading, like yang sheng, which is the art of basically longevity, like learning how to live a life that's harmonious with good health and living well and living long. And I was interested in the feng shui, which is about, again, it's not as esoteric as it sounds. It's about living in an environment that supports who you are and who you're becoming. And I was interested in the bodywork part, which I wouldn't call it Tuina, although Tuina is like the massage component. But I was more interested in learning about the muscle tendon channels, because actually what a lot of people don't know is that in Chinese medicine, there are muscle tendon meridians that are not related to the acupuncture channels. They correlate with them, but they are separate. And it's like they are almost identical to the ones that Thomas Myers pulled out of the body through fascia. So there was this guy that wrote his book. I forgot what it is. I can send it to you. And he did a pretty good job of mapping out the muscle tendon lines with what the classic texts say, with Travell's work on trigger point therapy, but I thought, wow, how amazing is it that I got to study with Cynthia, because she actually learned from Travell, and I could tell that this guy did a really good job. However, he kind of had some pieces that were missing, in my opinion, where it's just like there needed to be a little bit. I could tell he wasn't a body worker. Let me just put it that way. And I said, okay, wow, this would be so good for body workers to learn, because ultimately, if you've ever gotten acupuncture, it's really incredible. And I really believe that it treats the psycho-emotional stuff so well, like mental health stuff. I really believe it treats nerve things so well as a lot of other things. And, I think it's funny how every practitioner will tell you, my modality treats the best. It's the best and it treats everything. And it kind of makes me laugh, because like I don't always necessarily think that. Like I don't always know that massage treats everything, or I don't know that acupuncture treats everything, or vice versa. But anyways, I kind of started to realize, I said, wow, it would be so great for body workers to learn these muscle tendon channels, so that way they could have a different modality to use. Because if you've ever gotten acupuncture and you have pain, it can be really good at treating pain, because it can work with the nerves to turn off the nociceptors and help you like alleviate that pain. But sometimes you just want someone to get in there. You want someone to just like work it out, because you feel the kink. And because acupuncture is so subtle and like more of a, for lack of a better term, energetic therapy, because it works on such a subtle level of the body, you sometimes want someone to really just work out the kinks, which I think the body work is so good at. So you need both, I think. You need multiple things. No one thing will fix all. But I was looking around to see if anyone taught anything like this, and no one did. And I basically pulled from all my books, and I got everything. And I pulled from Thomas Myers's books. I pulled from like the ancient Chinese books, like the classical texts. I pulled from Travell and Simons, and I finally made a class that shows these meridians in the body. And I just taught the first one, and I realized this class needs to be way longer, because it was great, but there's just so much stuff. Because all of a sudden, if you use the principles of Chinese medicine, which are very practical in the way that they do things, because every one system of the body, every one organ has a system of function. So for example, the heart does all the things that it does in Western medicine as in regards to cardiovascular health, but it also has this other level of working with the emotions of a person, and which is, I think, really interesting. And I think we don't really always pay attention to that. And if you point to yourself, point to yourself.
What is it
Point to
again?
yourself.
Point myself?
Yeah. You generally point to your heart. Sometimes you point to your head, but if that's where you're living,
Right.
but sometimes
I just kind of go like here.
But that's because that's where you are. That's where the consciousness is. And I think the Chinese were really good about understanding that. And that's why I think so many modalities don't work, is because they're trying to treat the illness. They're not trying to treat the person. And that's why I really like Chinese. Or holistic health, or whatever you want to call it, because sometimes I pull from principles of Ayurveda, sometimes I just pull from psychology. I think the big term right now is like biopsychosocial, but I don't really keep up with trends, so.
Well, there's a lot of name out there, yeah. And I totally agree about using a different modality, like acupuncture with the body work, neuromuscular therapy. I myself actually do get acupuncture on a weekly basis right now, and I can actually feel the difference. Totally. You're right. It's very subtle, but it's
you look so young too.
Thank you. 59. I'm gonna be 59 in a couple of weeks, Travis.
That blows my mind.
Can't believe it. I can't believe. So I noticed that using both modality of acupuncture and neuromuscular therapy really helps a lot, and some of you may know already, I've gone through a lot of health issue with long hauler COVID, symptom. And it's this work also helped me too. With I do, besides working out, go into nature, meditation, working on myself. I do use neuromuscular therapy, body work, and also acupuncture. And I noticed a difference too that has been helping me quite a bit. So I totally agree with that. It's how we can holistically, heal ourselves in a very most natural way. And also the kind of food we eat too. You were talking about, into the health and wellness. I am in that area as well. And that's why this is kind of cool that you come in and share about this. So Travis.
Sorry, can I add something there? what you just
Please.
said about health and food, I think is so important, because in Ayurveda, which is like, it literally means the science of life, and it's the body of medical knowledge that comes from the place that we would call India today, but it wasn't India back then. But anyways, I remember learning Ayurvedic nutrition from this incredible doctor, Dr. Monica, when I was at school. And I ended up going and working with her for a little bit, because she really changed my perspective on food. And one of the things that I really started to understand, seeing in my bodywork practice, was that you are what you eat. And I know everyone's heard that before, but I started to feel people's tissue, and I could really tell if they ate too much gluten, because their tissue would be too elastic, if they didn't have enough hydration, because things would feel dry. And that's actually one of the things that, like, if you've been one of my clients or patients, you'll come in and I'll probably tell you need more soup, or you need more, citrus, or you need more, something to help lubricate the muscles. So it's so interesting, because I think a lot of the times you can actually feel the quality of tissue change based on the diet. And that is just so interesting to me, because the muscle holds so much information, it holds so much memory. I think that's why there is muscle memory, and I think that's why people have emotional releases, but that's another topic. But ultimately, I can't tell you how many times I will feel someone's, like, Achilles tendon. For those of you that don't know anatomy, if you're watching this, like, it's the tendon that is like right at the base of the heel. It is so tight, it feels like it's going to rip. And then I'll feel the calf and it just feels dried out. And I'll ask people about their diet, and I'll say, like, what do you eat? And a lot of the times, like, sure, they drink a lot of water, because they say, when you ask people about diet, like, they'll say, oh yeah, I drink water, oh yeah, like, I eat healthy, but maybe they're not getting enough minerals, maybe they're not getting enough electrolytes, maybe they don't have enough vitamin C. And there's a whole chapter in Travell and Simons that talks about all of the essential nutrients and minerals for healthy muscle tissue. So are nutrient deficits, you're more likely to have trigger points, you're more likely to have pain. And, like, one of the most fascinating things I'll see is that if you ever get lines right here that come this way from the outer canthus to the eye that go this way, it's actually, they're called pain lines. And you get them from wincing. You get them from, like, I'm in pain, like I'm wincing. And whenever I see that, that actually tells me that someone doesn't have enough fat in their diet. And I recently had a doctor come in. I don't know if I told you about this last time I saw you, but I had this doctor come in, and I'm still working with him, and he's great. And I asked him, I said, do you get enough fat in your diet? And he kind of laughed, because he was like this really, like, fit guy who's just, like, in my opinion, over exercising a little bit, but that's fine. I don't want to be critical of that, being a doctor is stressful. But anyways, I asked him, is, like, you get enough pain? He's like, oh, like, you get enough fat? He's like, oh, I don't really, like, eat too much of that. Like, if I do, like, it's just when I'm cheating. And I said, you might want to add some more, like, olive oil, or, some avocado, or, like, something. And he goes, why? And I was like, well, like, a lot of the time fat buffers pain, because, like, essentially the myelin sheaths of the nerves, which, like, stimulate the pain, they are made of essential fatty acids. So if you have more fat, it will help buffer that pain. And one of the signs and symptoms of that is seeing these pain lines. People don't have enough fat. So I kind of laughed after the fact, because I just said that to him, and he goes, oh, that's really great. I need to tell that to my patients. I'm a medical doctor. And I said, oh, wow, I should watch what I say.
That's awesome. Oh my God. That is amazing. You could have been a doctor, Travis.
But thank you.
No, you are very, very, very talented. Because since I met you, I always thought that, my God, you're very, very, very talented, very, very intelligent.
Oh, thanks. I'm just a nerd, but I appreciate the compliment.
Maybe that's what made you wise beyond your years. That's why. So talk about that. Talk about people who works out, because I notice a lot of people who works out tend to have tight muscles, tight, soft tissue. Would that having something to do with food they eat too? Or it's just
That's a really
overworked
good
out?
question. Yes and no. It's funny. I take such a holistic approach now. So I was really thinking, when you're like, I want to interview you on neuromuscular therapy, I kind of thought, and I was like, wow, I should probably study a little bit more, because, like, I've branched out into these are my roots, and I still open Travell and Simons. We just had a patient the other day tell me, yesterday actually, she told me, like, when I reach behind to grab something, it hurts. And I said, oh my God, I need to open my books, because I don't remember what muscle that is, but I know that's word for word in Travell. Haven't looked at it yet, but I will before I see her next time. But anyways, to answer your question, One of the things I'm noticing now, because my practice is in Beverly Hills and it's in LA, I am noticing there is this trend of over exercise. And it's become so part of the culture that like I get a little bit nervous that people are overtraining and that they
Mhm.
have maybe a little bit of body dysmorphia. So yes, I think sometimes like, if you are working out a lot and like I'm not a nutritionist, I'm not a physical therapist, I'm not a personal trainer. I just have a background in East Asian medicine and I like research and I know neuromuscular therapy. But I will tell you that when I work with people, I a lot of the times will look at their eyebrows. And if they have big, strong eyebrows, I know that sounds so weird, but I know that they can work out a lot. And when I see the eyebrow hairs starting to thin, that tells me that they're overtraining because their liver's tired. Because in Chinese medicine, the liver is in charge of the tendons because the liver stores the blood. So if the liver is in a deficit, then it means that not enough blood can nourish the tendons and the tendons will have issues sometimes. I mean, it's a lot more complicated than that, but that's a really basic understanding. And you'll see like, redness of the eyes, but like the thing I really look at is the eyebrows. So if people like, to give you an example, and to go back to your question, I have this person that I was working with, and he is like this really, really like athletic man. Like, he's a nurse and he works out all the time. And like he starts his day with what does he start it with? Like a Trenta iced coffee from Starbucks and he puts like 5 shots of espresso and then he takes Adderall and then like and then because he can't sleep at night he takes Ambien and he has also like bipolar syndrome and he's a really great guy. He's just like he has so many ups and so many downs. So one of the things I always told him because like when I studied feng shui, I was always taught that if you go into someone's home, if you want to see the way that they take care of themselves, you look in their cabinet, like you look in their fridge, which I do when I go to people's houses. I ask, I'm not just like opening things, but oh, do you mind if I take a look at the pantry? He's like, oh yeah, why? I was like, I just want to see what you have in here. Maybe like, maybe we can find a clue as to why you have so much chronic pain. Because he had like really good muscles, but when I opened the fridge, because he was one of those people that looked like really fit. Like he looked really fit. You would think he was healthy if you didn't look further. So when I opened the fridge, there was nothing. There was like maybe like a protein shake, and like he had like one banana on the countertop, and he had like I think like some freezer burnt ice cream. Like there was really nothing in there. And I looked in the cabinet, and there was like one can of beans that had expired. And
Wow.
I said, huh? Like, do you like how do you eat? He's just like, well, I don't eat too much. I was like, do you like food? He's like, yeah, I like food, but like, like I only eat like when I feel like I need to. And I realized he was overtraining so much and he wasn't eating. So one of the things I told him, because his at this time, his bipolar was really, really bad because like when he's up, he was really happy, but when he's down, he's really depressed. So I told him, I was like, food is really grounding. I know that you probably don't have a lot of appetite because of like, the Adderall and because of the caffeine, which I don't want to be critical of any of that. People can live their life however they want. I just want to help them be happy. Like that's all I care about. But anyways, I said, try eating more. Try eating like at the same time every day if you can, just one meal. I don't care what the other ones are because if you know anything about people with bipolar, it's a rhythm disorder. They're up, they're down, they're up, they're down, and they don't really like equilibrium. Although, like, it's really good for them. So, anyways, I got him to eat. He decided he wanted to eat like at 11 o'clock because it was after his workout. He liked to do fasted workouts. And then it was before, like, he had to go in and do like his work. So he started doing that every day for a week. And all of a sudden he's like, wow, I noticed I have more energy. And then he did it for about a month and he started eating 2 meals a day because he really wasn't eating. And then he started cooking for himself. And all of a sudden, like, then he started meal prepping and he started really like doing all these things. And before I knew it, he looked so much better. He had so much more energy and his chronic pain had diminished by at least 50%. And it was really from the fact that he wasn't eating. And
Mhm.
granted, like I talked to him a little bit and I figured out what foods he might need and all this stuff. Because for him, actually, we wanted to give him more salt, which is another story. But anyways, he really needed food. He was just so nutrient deficient. So sometimes that is a really big factor if people are under eating and they're overtraining. But ultimately, I think too many people are overtraining. And I think that it doesn't really matter what you're doing with your diet, if you're overtraining, your body's going to fight you on it.
I
And
I was one of those. Yeah,
yeah, I mean,
I
I think
was.
we all are. We
Yeah,
want to look a certain way, and like we live in Southern California where it's like it's very much a very like
appearance.
body-minded culture.
Yeah, totally I agree with that. And I have to say, I was one of those that I used to work out way too much. And I noticed that I tend to have no matter how much massage I have and all this stuff, I tend to always feel sore and inflammation, and because a workout also causes a lot of inflammation and never get to rest. So every day I would just hit myself with a very intense workout. And I noticed that now I realize that perhaps part of the reason why I got COVID is because I work out way too much, and I already accumulated a lot of information in my body. And it's created imbalance. So I have to agree with that. And also kind of food that we eat too. So I really like the fact that you even able to see how it shows on a face with what they eat. Because now I realize that nutrition is very, very important in what we eat. You are what you eat. It's really, really the fact. It's a truth. Because I noticed that certain food will cause inflammation or cause the bloating and all that stuff. Oh, food sensitivity that we most people have and don't realize that. So that's a good topic
Yeah.
to talk about, Travis.
Yeah, I mean, that was one of the things actually that when I taught my class, all the students wanted to talk about. And I was just like, one day we'll do one on food because actually that's one of the things that one of the projects I'm working on is categorizing all of the foods and like sure they're macros because in the Western culture we focus on macros, which I think is great.
Hmm.
I think that's really helpful because to me it's so interesting that you can completely change the composition of your body by what you eat. And you can do that by looking at the macros. But 100 grams of Cheetos is very different than 100 grams of broccoli. And a lot of people, I think, I don't know, like when you're focused on the macros, sometimes you don't care. And maybe you have a strong enough constitution. Maybe your goals are different. Maybe you don't really aren't so mindful of what you're eating. But there was this really great book by Dr. Uma. I can't say her last name, called "This Is Your Brain on Food." And she talks about all of the mental health benefits of food and how food affects your mindset and helps with anxiety and focuses on all these different things because I think like 80% of the serotonin, like that happiness chemical is produced in your gut.
Yeah.
So it's like it's really interesting. But yeah, so like when I work with people, going back to neuromuscular therapy because we could totally derail and go off topic. Um,
No, actually,
Sometimes I
I
can.
think it's good. I think it's good that you kind of got derailed because I think it's because everything to be in live a healthy, happy, healthy living is not just the body, but everything else. That's just like when you said, it's just not one technique of therapy that helps person to heal. It's a combination of that. So, I
Totally.
just kind of like that you integrate the food and even all this stuff because the audience can actually learn from that and realize that, hey, I'll give myself this kind of body work, but also, hey, I may try the acupuncture, I may learn food that you're just talking about, which I think is very important. And a lot of people may not, a lot of people, some people are aware of it, some people already practice that, but there's still a lot of people are not really put a lot of focus on eating healthy or what is healthy.
Yeah, and the body is so adaptable that we can really adapt to any diet, and that's so interesting to me. And I sometimes am envious of those that can eat whatever they want because I've never been that way. I mean, I was when I was little, but like, it's like if I eat too much gluten, like, or if I eat too much sugar, like the worst things happen to me. And I like these things. So, but like I'm being asked to like take care of my body and, to do things differently because like you see some people that can eat junk food well into their 40s and like they have no problems versus like if I look at gluten sometimes I break out, I mean not really, but I just I know my body can't handle those things, but the gift of that is that it really forces you to learn to take care of yourself. So
Yeah.
I think that's really great. When it comes to exercise in the body, yeah, that is how you get more trigger points, and that is how you get more because you're breaking down muscle tissue to build it. So I think that just to answer your question, I think sometimes people are a little bit too body focused and that we push our body past the limits. So some of the signs and symptoms I look for of overtraining, I do look at the eyebrows. But I ask people, do you have low back pain? Do you feel pain in your heels, like, at the calcaneus? Or do you have knee pain? Because those three things will tell me that you are overusing your body all the time. So, in the Chinese five elements, that's the wood element, the element of doing, it's the liver loves to do things. It loves to take action. It wants to exercise. It wants to work. It wants to just do things. So if you use too much wood, you drain all the water, which is the kidney energy. So you're basically depleting the body because you're overusing it. So a lot of the times for people like that, I'll tell them to lay down more. And I had this client the other day, a while ago actually, but I just saw her again. And I remember I said, because she had almost no eyebrow hair left. And it's not like she's working out. I mean, she did tennis and she did a lot of things in Pilates, but she just couldn't sit still. And I asked her, because she had all this chronic pain. And she actually had bursitis in both the elbow and the hip. And what's so interesting about bursitis is sometimes it can be about repressed anger. Sometimes, not always. I mean, bursitis from the Western perspective, which is valid, and we need to start there before we go into other things. But
Yeah.
it's about friction. It's about too much friction on the area of the bursa, which causes the inflammation of the bursa. But you know what? Friction, a lot of the times, is a byproduct of anger. So let me tell you, this woman was very woody. She's very upset. And I remember I told her, I was like, have you ever thought about taking a nap? And she goes, what? You want me to nap? That's for lazy people. Don't you dare tell me to nap. And I kind of laughed and I was like, it might help with your pain. She's like, can you stop saying pain? It makes me sound weak. And I just laughed because she was so type A, which is a wood mentality, which I talk about that more in my classes. But, it was just like, and I love people like this. I really do, because they're the people that get things going. And I really want to be clear. I don't really care what you do. I don't really care how you live your life. I'm not going to be judgmental of that, because, who's to say what's good or bad? Everything is just different. So just because I do things differently than you, I like to take naps and I like to sit down. Doesn't mean that I'm going to think you're weird if you want to overwork, because I think that's really great because you can accomplish things. And you might think I'm lazy, but I'm learning how to enjoy my life and how to sit down. And, because I used to come from that really type A background, because that's how my mom is. So I remember I'd be like, I want to lay down, I'm tired. And she'd like, you need to work harder. You need to do more, get up, stop being lazy. And I was like, oh, but I just want to play. She's like, there's no time to play. So I get it, I do, but it's just, everyone's different. We're all wired so differently. So for her, one of the things I told her, I said, you might want to incorporate more bone broth into your diet, and you might want to have more sour foods. And the reason I told her that is because I could feel she was so blood deficient. And I think she was at the age of menopause too, which a lot of the times, if during menopause, it can be really hard. One of the signs and symptoms of that is the hot flashes and the restlessness and the inability to sleep, which Chinese medicine is really great at treating these things. I don't treat that stuff. I personally think a lot of the times women are better at treating women's health issues because they understand it in a way that men never will. But I know a little bit, and I told her, have some more bone broth, because you're around that time, and also have more sour foods because it will help you hydrate your tissues. And also too, one of the things, citrus cuts anger, it helps with that, because she was so frustrated because she was working on this really big project for her house that she was upset that the workers weren't getting things done on her deadlines and her timing. And, she was just a very type A person, which,
Wow.
but I was trying to teach her to relax a little bit, which the massage was good for her.
I like what you just shared, Travis, because nowadays most people are in that cycle of do, just a doer and trying to do so much. And most people don't even make time to rest or make time to take a nap or make time to slow down. We are living in a society, this is global now, not just here, that everything just moving so fast, and all we do is just overdo everything, and it just creates the imbalance. And I believe in the Chinese, teaching, everything's all about creating balance, so I like what you just shared, is that slow down. You don't have to try. We're never going to finish anything anyway. I realize that. We're trying to accomplish all this project, finish this, finish that. We are always on the schedule, on the deadlines, and we're always trying to overdoing too much, where we become so stressed, and that's affecting a lot of health issue as well. So I really like what you just shared about that, is to slow down, and how you share with your clients to stop doing.
Yeah, I mean, well, it's funny because actually, like, so when my teacher Lillian passed away, about a couple months ago, I went to go see one of her. I don't know, she was the executive director of her school, and she's really amazing. Her name's Kelly Harrington, and
Mhm.
I set up a consultation with her, and she's looking at me and she's looking at my face because this was before I taught my first class, and I wanted to see how my other colleagues and classmates and people that studied with Lillian, how they did things, because it's kind of like massage where it's just like, so many people learn the same thing, but everyone uses it so differently, whether it's for business, whether it's for matchmaking, whether it's for personality, whether it's for health. And I really love Kelly because she's so sharp and she's so kind about the way she does things. And she's not an acupuncturist. So she gives this really unique approach because she doesn't have that medical background, which like I really like because it makes it more relatable. So, anyways,
Mhm.
she told me, she goes, "You're doing too much." She's like, "You're overusing your liver chi." And I was like, "Oh, but like, my eyebrows look good." She's like, "Yeah, but they could look better." And I kind of laughed and I said, "Okay." And she goes, because I think I told her I was like having issues with productivity. And she's like, "I want you to not work out so much." She's like, "I want you to do like more restorative yoga if you need to work out." Because I was like, "Man, I love working out." She's like, "How much are you working out?" And I was like, "Maybe like 2 hours." She's like, 2 hours? That's so long. I was like, "Yeah, but like, it's like it's a slow, like, I warm up and like it's a whole thing. If you like the gym, you get it. You know what I mean? Like you go for a while, and I was just raised
You're
with
there
that
two,
mentality.
3 hours, 4 hours sometimes.
Yeah, right. It's like, it's a social thing. You run into
Yeah.
people. I don't know if I spend that long there, but I would go and then I would go do massages because I realized I couldn't do work, weightlifting after my massage days. I couldn't. It was just too much. And then I
Yeah.
couldn't do, I tried to do it beforehand, and then I would just come home and I'd be really, really tired. So I said, okay, like maybe I need to like change this a little bit. And at the time, I was writing my curriculum for my classes, and she's like, why don't you try stop working out for a little bit? So I was like, okay, I'm gonna try stopping for 30 days. Okay. And
Wow.
every day I had to like negotiate with myself, like not to do push-ups. And I was like, ooh, I think I have a little bit of, it's called bigorexia, but it's like exercise addiction, and it's just so funny because I really had to slow down. But in that time, I all of a sudden got so productive. I got so much work done. I got more work done in that month than I did in the last like 4 months because I didn't realize that going to the gym was like a part-time job because you got to do more laundry, you got to cook, you got to take time, you got to drive there, you got to shower. You know what I mean? Like there's so many aspects to it that each one of those things don't take too much time, but ultimately they add up. And I was like, wow, I was spending like, 15, 20 hours a week, like, focus on these things. And that's time I really needed to be writing and to doing curriculum and stuff like that. Now I'm back to the gym now, but I'm really respecting my body's limits because all of a sudden I didn't feel so tired after my massages. And I really didn't like this, but I'll tell you, I realized that doing massage therapy is manual labor and the body can only do so much manual labor. And everyone's different. I know for my body, I shouldn't work out more than too much, like more than a little bit. I have to work within my limits. So it was just so interesting because I didn't realize that I was overtrained. And, I watched my body change. I watched my eyebrows change in that short month. I watched my face get fuller. I just watched myself feel more happy. Now I had to get out of that mentality of thinking that I should look a certain way because, after you go to the gym, you feel really good. So I had to
Right.
kind of, get a better relationship with myself. Like it'd be a little bit kinder to myself, when I look in the mirror and stuff. But it was actually a really big sign that I was like, wow, I think, exercise addiction is a little bit more prevalent than we think because we think it's so good. So that's great for business. It's great for like neuromuscular therapy. It's great for massage, because it's so helpful. But when I see people that are overtrained, I tend to just let them sleep on the table because like it's very rare that like I don't. I'm a little bit unusual in the way I massage because I'll normally talk to people the whole time,
Mhm.
and like unless people are overtrained, and then I actually want them to sleep because I don't want them to be too active. I don't want their minds to be too active. I just want them to be able to go into that restful state to help build the body back up. So it's a little bit unusual because people always tell me they're like, "Wow, you talk more than any massage therapist I've ever worked with." But you get results that no other massage therapist did, and I was like, "Wow, that's kind of nice." I think.
Well, you're educating them, I'm sure, because by talking to them, you're telling them what they need to do to improve their well-being, you know.
I just ask
So
questions. And one of the things I'll tell you is like I have kind of gotten really good at making people cry. Not because not because like I'm mean, not because like like I'm being aggressive in the massage room,
yeah.
but actually because like I just ask them questions about their health and I ask them questions about their bodies. And actually one of the most effective medical tools I found is asking questions, because a really good question can get someone to think differently about their life. And then sometimes when I ask them, why do you think you're in pain? Why do you think you're doing so much? Because like, I had this client that was doing so much. She was overachieving in everything. She was working really hard. She was working out really hard. She was like, putting in these really long hours at the office. She was doing all these extracurriculars. She was never sitting still. And I saw that she had these like really deep lines going down on her face. And I said, what has got you so sad? And she goes, what? I'm not sad. And I was like, why do you feel that you need to do so much? And she goes,
Mhm.
oh, well, because when I sit still, I think. And I was like, well, what is it that you don't want to think about? And she just starts crying.
Oh,
And it was because she actually just went through a really traumatic breakup where she was with this guy for so long, but then he ended up cheating on her and he left her for another woman and all this stuff.
wow.
And she was doing so much as a byproduct of that pain. So sometimes, like, I think when we get underneath the why, which I learned from my teacher, Lillian, she would
Wow.
always tell me, she says, look and see why people are doing what they're doing and you'll get your answer. Look and see why people are acting the way that they're acting and you will get the answer. Because a lot of the times, action or anger or like, frustration or these things are a byproduct of being hurt. So you should really be working with the heart, not with the liver. You know what I mean? So for her, I
Wow.
wasn't telling her to rest more. I was actually telling her, like, maybe it's time to go to therapy. Maybe it's time to, maybe it's time to process some of this and to like, maybe let go of some of the old things in the house that remind you of him. So you're not like, she never wanted to be home because all his stuff was still there. And I was like, why don't you pack it in the box?
Wow.
Like,
See, not only you working with the client's body, you also being like their personal therapist, psychologist, or yeah, you actually help them a
I
lot
don't give
because
medical advice and I really rarely tell
yeah.
people what to do. I actually don't tell people what to do because I'm a firm believer that like we need to be more proactive in our own healing, because I think the things that we do for ourselves are more beneficial than anything anyone else can do for us. So I might tell people what to eat. Like, that's about as far as I'll go. But
Mhm.
even then I'm kind of careful because I know like you have to be cautious, because I think only nutritionists can give people like recommendations. So I
True.
say, so the way I say it, it's like, I'm like, oh, like, bone broth does all these things. Like, why don't you consider having some?
Exactly. Well, with that said, disclaimer here, always do with this YouTube thing, this is just, it's not medical advice, guys. This is just entertainment only.
Well, I
But
also too because I have to be careful about what I tell people sometimes, because people will come back to me like way later, like years later,
yeah,
and say, I remember when you told me this thing, like I still do that. And I'm like, I
yeah,
told you that? Why did I tell
yeah.
you that? Like I don't even remember saying these things sometimes. And they'll be like, wow, that changed my life. Or like, wow, like, like I had one person who I told them to stop eating so much spicy foods because she was having like really heavy periods and she was having like all this heat in her body. And she like completely stopped eating spicy food. And she's like, I still don't eat spicy food. And like, that was like 3 years ago. And I kind of laughed and I was like, I didn't say stop eating spicy food altogether. I just said that might trigger your symptoms if you're having too much of it. Because that was her favorite thing. She goes, what?
So,
I can have spicy food? And I was like, yeah, you can have spicy food. You should have all the foods.
nice.
Like, enjoy what you eat.
So Travis, where can the listeners, the audience, find out what should they eat? I mean, because I think it's certain food is good for certain people, but may not be, it may be too sensitive for another person, correct?
Yeah, totally. I
So
really
if they
like
want to
the
find out about that, where would they get that information? You offer classes or some sort of like books or whatever that the audience can actually get? Because I think it's very specific to a certain body, certain people, right?
yeah. I really like the book "This Is Your Brain on Food" by Dr. Uma. I don't agree with everything she says, but I love that she uses so much information about mental health, and she does a lot of stuff about research. So she pulls all this really great research. You know, but there's certain like food combinations that I don't know that I agree with, but everything else is like really fantastic in that book. I pull from so many different places, and like I was taught the old school way. I was taught the apprenticeship method, and like that's how I learned. And when you learn the basic foundations of Chinese medicine or of Ayurvedic medicine, you understand the principles. So the best thing I can tell you is to learn from yourself Because I was taught you want to eat the sun and breathe the moon. And I don't know if we talked about this last time, but I'll remind you is like, the reason you want to eat the sun is because the sun is like this really condensed form of energy that comes down to the earth and makes plants grow. So the really, when we're eating plants, we're essentially eating energy from the sun, because like, it's filled of that, that really good, solar chi, that yang chi, it's what gives the body energy. So essentially, I will say that eating really fresh foods, like, if it comes from a bag or a box, maybe like consider whether or not you want to eat it. Like, what's the saying? Like, if you go to the grocery store, if you go around the outside, that's where all the things that you should buy are, because everything in the aisles is junk food. But at the same time, like, I don't want to tell people like they shouldn't eat the things that they enjoy. Because like, yeah, eat some brownies, eat some cupcakes, like eat whatever. Like, don't have 20 of them, but like have a bite, have to, because life is meant to be enjoyed. So the best thing I can tell you is intuitive eating. And I think that's really cool. So like, when you're eating the sun, you want to eat like really fresh foods, like, like that come from local sources that are in season. You know what I mean? Like, you shouldn't be eating watermelon in the wintertime, because like, it's probably way too cold and there wasn't enough sunshine anyway to make that watermelon. So why do you need so much cold, like, in your body? Because watermelon can be very cooling. So I would say, like, eat locally, eat foods that are local. If you can cook your own foods, great. And if you can't cook your own foods, hopefully you can, like, find someone who can either cook for you or create really high quality foods, because cooking is a form of self-care, and cooking is a form of self-love, because only you know what your body needs. So the way you should be eating is like this intuitive way of saying, like, what does my body really need right now? What does my body crave? And to give you an example, like, I did that bodybuilder thing for so long. Like, not that I'm a bodybuilder. I probably talk like I am, but I'm really not. And yeah, I'd be a little bit bigger if that was the case. But
not
anyway,
necessarily. You don't take drugs, so that you won't get, you see, only when you take drugs or steroids, that's when you get that huge. Yeah.
Yeah, but one of the things, like, I will find is, like, sometimes I really crave vegetables. Like, I really crave foods that have moisture. So like, I found myself, like, my aunt gave me, I went to go visit my aunt, and she's like, she's from Mexico. So I cracked up because she gave me like a coconut. And this was like a couple weeks ago when we were in like the heat spell. And she gave me like this like coconut, like, that was like unopened. And I was like, you want me to open this? And she's like, yeah. And then she gave me this jicama, which, if you don't know what jicama is, it's a root vegetable. It's like, it's really full of moisture. It's really good. And I kind of laughed. I was like, these are so inconvenient to open. Like, these are really like difficult foods. Like the coconut, like, I was like hacking it out with a knife, like trying to open it. And I got it open finally. And I drank the water and I ate the flesh. And then I peeled, like, it took me like 20 minutes to peel all the jicama and cut it up and all that stuff. And I squeezed some lime on it and, put a little bit of salt in. I ate these foods and I was like, oh my God, these are just what my body needs. And the interesting part is, like, now we're in Chinese fall, or like, in the fall season. And you can tell that it's fall because of the way the colors are changing, the way the sunsets are really beautiful, the way that, like, all the leaves and the plants are starting to die. And ultimately, the first sign of fall will always be spiders, because it's dry and spiders like dryness. But anyways, during this season, it's related to the metal element, which is the season of fall, this is like really basic Chinese medicine, which is like related to the lungs, which is related to the color white. So like, a lot of the times these white foods can be really good for the body, because after coming from that really, really hot, intense sun, which we're in, you eat these foods that are white, that have like moisture in them. They cool the body down, like coconut, like jicama. And I ate these foods and, like, oh my God, it's just like my body just like vibrated. And I realized my body needed more moisture. My body needed more foods that had moisture, because sometimes drinking water is not enough, especially if you're drinking purified water. So to answer your question, I'm working on a course that's like on the list of many things to do, because I would love to teach people more about food, because actually I'm finding now I'm kind of transitioning out of massage. I still love massage and I still love doing neuromuscular therapy, but I really think it's more powerful to empower people to find things that work for them, because I don't really care what you do. I just care that you do things for yourself. So like, finding, like, if the best thing I can tell you to do if you want to learn how to eat better for your body is say, what does my body really need? Is this really going to make good energy for my body? And like, if you do that simple thing, I promise you'll make very different choices.
Wow, that's powerful, Travis. Now, Travis, what are you currently teaching right now? so you can tell the audience, because I know you
Oh
teach
yeah.
that.
Okay. So the next class, I'm actually working with Panacea Holistic Institute in Long Beach. We're going to set up a class. It's going to be called Emotional Alchemy: How Feelings Affect Your Face. We might change the title. I'm not sure yet. I'm working with the owner. She's this really great woman. Her name's Jocelyn. But anyways, I'm working with her to set up a class at Panacea. So we're going to do a class on facial diagnosis and facial reading. But I'm reworking my class into a series of courses because when I taught it the first time, I did a 3-day intensive. And on day 1, we did anatomy and like all the muscle tendon channels. Day 2, we did Chinese medicine and the meridians. And day 3, we did facial reading. And I realized each one of these days needed 5 days, not one, because I tried to teach all 12 meridians in one day. So, I gave the students an extra day and like we talked and had a really great group of people and it was fun. But yeah, I'm working. So actually, I plan on going to Yosemite because that's where my grandparents live, and spending some time with them and doing all my writing to get the courses done. So the next course will probably be we're going to do a sampler sometime. But if you would like, we can probably do like a little sampler and, do something about like, either nutrition or like, face reading or anatomy. I mean, you pick it, Tina. You pick the topic.
Absolutely. Yes. It's always very fun and also very educational having you here, talking about all this stuff. Because I learned something from you today as well.
Oh,
It's
Tina, I learned
quite-
from you too. You're very intuitive. And, I was thinking about you the other day because I was like, wow, how cool is it? You're meeting all of these different people. You're interviewing all of these different people. I'm sure it's made you such a better practitioner, but also it's probably made you a lot more open-minded. Not that you weren't before, but open-minded in the sense that all of a sudden you have a little touch of all these different modalities, all these different, for lack of a better term, spiritual sciences, I want to say, like, these kind of different esoteric teachings that are really beneficial to the body and like really beneficial to people. And it's so funny because I have this friend who I studied facial reading with, and she is a medical doctor who does acupuncture. And she gave this, her name is Emily Rowe, and she gave this really amazing talk on health with her husband, because they are like such cool doctors in Florida, and they do like all these different things. And I think her specialty is treating mold, but like, cause she's just such an amazing woman. But anyways,
treating mold.
Yeah, mold toxicity, which is like
Wow.
really
That's very
powerful.
important. Yes.
Oh my God, yeah. And yeah, it's like it's really one of those silent killers. But
Yes.
anyways, which by the way, fat pulls toxins out of the body. And I found out as I was doing my classes, which I need to tell someone about this, but I found out doing my classes that muscle tissue will store toxins and it will store like toxicity. So that's why actually massage can be detoxative. Is that a word? Detoxifying. But anyways, it can do these things, which is really powerful and really cool. So, there's so much more to the muscular system. But anyways, Emily had said, because she does like astrology and she does like crystal healing and sound healing and like acupuncture, and she's a medical doctor. And
I love to connect with her. Yes, I love to connect with her.
I'll send you her info. But anyways, she did this interview it's on Spotify, and I listened to it because I adore her and her husband. They're really great people.
Mm-hmm.
She said, if something works for someone, who are we to try to criticize it? And who are we to try to say that it shouldn't work? And I thought that was just so cool because, it's like sometimes when you tell people the things that you do, like, it doesn't matter even if it's massage, even like, and I consider massage to be one of the more practical things that I do, which a lot of people don't.
Right.
And, you tell people you do these things, or, you tell them you do intuitive stuff or whatever it is. And they look at you like you're crazy. They look at you like, like that would never work. Right. And, who are we to like judge so quickly? And I think a lot of the times judgment comes from a lack of understanding. So I just thought it was so cool that this medical doctor is saying like, hey, like just because you don't think it works doesn't mean it doesn't. If it helps someone, maybe we should be open to it.
That is so profound, Travis, what you just said. Just because it works for you.
I didn't say it, Emily did.
Still, you pass it on. You pass it on, this word, which is very, very powerful. So thanks to Emily too, But it's just very powerful what you just said too, because sometimes we're trying to convince people to like, hey, do it this way. but it doesn't always work for everyone. Everyone have to experience themselves, be open-minded and experience themselves. One of the key thing is for me is like be open. Like what you just say earlier, I'm just so open to every topic, every subject. Doesn't matter left or right. It really doesn't matter. You know, listen to them from all sides, and I'll be the judge of that. I'll be the one just look at it, and because we changes our mind all the time. We changes our course. It's like a ship. You sail through the ocean, and when the storm, you just move to a different direction. But by going through different part of the world, we are learning so much. We're connecting with so many people, and learning from everybody. Yeah. So it's pretty cool. I
That's a
really
really
enjoy.
powerful statement because I got taught a lot. I spend a lot of time thinking about destiny. The Chinese word for it is Ming, because that was like my teacher's favorite topic. And I just think it's so interesting. And she would always talk about the river of life. And that reminds me of what you just said, because
Hmm.
I think there is this kind of flow to life. And when you're on the right flow, like doors just open. And when you're kind of trying to swim against the current, you just meet all this resistance every step of the way. So life is really mysterious. And I think that sometimes we get a little bit too close-minded just because the possibilities don't match our reality, which I don't even want to be critical of that. I don't want to be judgmental of that because
Yeah.
I was always told that people can feel energy if they want to, but a lot of people don't want to. And like, that's fine. That's probably what's the saying? Ignorance is bliss. So sometimes, like, when you, seriously though, like, sometimes when you know what's going on, I think a good example of this is like the news. Not that you shouldn't be educated, but sometimes when you hear all the things going on in the world, you're like, oh my God, this world is a terrible place. And my grandparents watch the news all the time because like they're 91 and they live in the mountains, so that's how they stay connected. And I just hear my grandma getting so negative about the world, which like concerns me a little bit. I'm like, maybe you should like not watch so much of this because it makes you a little bit fearful.
Right, right. And that can happen to a lot of people, that fear, you know. But well, Travis, thank you so much. And do let me know about your classes coming up. So, some people would be interested in taking, for example, your facial reading. Because the last video we talked, a lot of people actually mentioned they love your facial reading. How, I mean, very, very, how talented you are in just picking up, and you just get so much information.
Yeah,
And
the thing about face reading is that it's such a cool tool. And I'll just kind of end on this because I know you got to go. But it's such a powerful tool because I think sometimes people get scared that you can see things like, I don't know, like that you're going to
you
judge
can
them
tap
or
into
whatever.
them, they can read them
Yeah, and it's
clearly.
not, I wasn't really taught it that way. I know it comes from a judgmental tradition sometimes, but I was always taught you're actually just really being allowed to see someone, which is a gift. And you have to tread lightly with respect. But it's not like I'm going to tell anyone things they don't know about themselves already. Sometimes I'm just validating it or reminding them, or like
Exactly.
reaffirming it and putting it in words that maybe are more in alignment with, how do I say this right? I'm saying things in a way about them that they already know about themselves, but they just never probably heard it in words or never knew that a stranger could pick up on those things, which makes them believe it more because they're like, wow, if a stranger can tell me these things, then maybe they are true about myself. Because we tend to be morphable and changeable, and we tend to have all these different qualities. So face reading is really cool because it's a powerful tool in helping you figure out who you are and where you're going and how you've been. It's cool. It's really cool.
True, true. I agree with that. And you were very accurate on the reading as well, on my reading. So that's very impressive. Very
Oh,
impressive.
oh, thanks.
Thanks so much, Travis. Thank you, Travis, for being here. I really enjoy it. Next time, definitely let's talk about nutrition and food, because I think it's
Maybe
so
I should get like a
important.
PowerPoint or something, and then like
Yeah,
I'll get some topics.
get it. We can do a sharing on the screen here.
Cool.
Definitely. Yeah, you can do that. You can share screen, and audience can actually, because some people are very visual, like myself. I would have to sit in front of the class all the time because I'm a very visual person. So the PowerPoint would be a great tool for you to
What
use.
would be great is like ask your audience what they'd like to learn about like nutrition. And yeah, we can go from there because like it's such a wide topic. It really is. So if we can have a general outline of where we're going to go, that'd be even better. But it's funny. I know you asked me about neuromuscular therapy, and that was supposed to be the conversation for today.
You know
But
what? That's fine. It's meant to be. To me, whatever it is, how it flows on the top. I always take it as like that's how divine guide us, or we're guided to just talk anyway, because people come in and they watch the video. That's what they're supposed to hear, or
I
it would
think
be helpful for
Cynthia
them.
would be a really great person to interview if you can get a hold of her. She's
Oh,
really
I love
busy,
to
so
do
I don't
that.
know, but she's so fantastic and she will, God, she's such an amazing teacher. So it's
I'm
like if
gonna
you,
connect with her. I'm gonna connect, and
yeah,
she's amazing. I mean, one of the best. I mean, uh, she's very good. I learn a lot from her too. I have to say that because I always remember her words. I always remember her words, and one word I remember. She said, "Every time when you fall down, you have accident, or you have surgery, or just tiny, just let's say injection. Let's say you have even Botox or whatever, or vaccine. Your muscles will contract very deep just
totally.
to prevent." Yes, I never forget that word. So every time when I kick the bed, kick the metal piece, I'll go and get massage work right away, because it does make a big difference. If I didn't do it, I noticed that my muscle area that will get tight, you know. So it doesn't matter if it's just a little thing, you get that area worked out.
Yeah,
And I
she
never,
was the first master I met on my journey, and I'm so grateful that like it was just by accident at
yeah,
NHI, and she just happened to be teaching there. So she really is a master of her craft. She'd be
I
a better
agree.
person to interview
I
about
agree
neuromuscular
totally.
therapy.
Yeah, and for those who are listening and wondering who Cynthia is, she's the owner of the National Holistic Institute in Santa Ana. Actually, they have more locations, 7 or 8 locations right now.
She's not the
And
owner. She's the she created the neuromuscular program.
oh, I
Um,
always thought that she's the owner of the
she
institution.
used to own Win Institute, but then she sold it to NHI. And then they were able to like reach out and like branch out into more programs. And she's like a really famous or maybe the better word is well known. She's a really well known speaker, and she's truly like a master of her craft and really well known in the industry for being
Yeah,
great.
true. She's really a true master in her area, in this area. So if anyone interested in this kind of body work, I would highly, highly recommend
Yeah,
her.
all the reason I'm good at massage is because of her. And all the other
Likewise.
teachers I had. I don't want to discredit the other people that I had, but
Right.
it was because of her work to the field that I think so many people were able to experience neuromuscular therapy.
Yeah, and there's not a lot out there that's practicing this work or doing this work. Really, that's not enough.
There's
I
more
don't think.
now, and it's funny actually.
Yeah.
The chiropractor I work with, because he's like, because I'm busy, I'm doing my own thing, and I told him I said, find someone that does neuromuscular therapy. Go to NHI, go like ask for this kind of person because I promise you, you'll get more people. Because the last guy he hired did more relaxation massage, which is fine,
Yeah.
but in a medical setting, that's not really what you want because you're
Exactly.
working with pain. So like he hired this girl, and she's still in school, but she's doing fantastic. Like she's fully booked because people are getting results. So I said, wow, that's so great.
It's a result they get. That's what it is when they're in a lot of pain, which, we were going to talk about this at first, is how you can release your pain too. This is one of the technique you can, find, is to find someone who knows this work, neuromuscular therapy. And Travis you don't do a lot of those anymore. I know of
No,
Travis,
I
but
do. I
he would
do a
be good.
lot, but it's funny. I work with pain all the time. Actually, that's my specialty. But I'm finding now that like the muscles won't release until you get to the cause of the pain. So I spend more time digging and finding out why someone has pain.
So true. My
Um,
God, you're so right. I always question that too. It's like, they constantly got information in their body, or, it's get all locked up. And I
yeah.
realize the
So
food.
I am a little unusual in the way I practice, but like I will, and that's why like I go to the food. I go to like I go to the emotional stuff. I go to like the whatever it is, like the lifestyle stuff that is like causing their issues because like I work with pain all the time. But I kind of figured out until I get to the root of the problem and I treat the person and I listen.
Oh my God, this is amazing, Travis. You know what? You actually digging up into looking at all these different areas that's causing all this problem, because your clients always have pain anyway. And because of all this different aspect, you know, everything that it's a combination of the cause of the pain. That's why. So I love the idea that you are doing researching and trying to figure out all this emotion and food and all this that contributed to the pain, and help people in to release those pain. I think it's an amazing path that you're walking on. I like that. I really
Thanks.
love that. A lot of people know, no, you're not weird. You said you're kind of weird that way. You're not weird. You're actually a genius. Okay, you think deep, and you dig deeper into the rabbit hole just to figure out how you can truly give that whole, type of healing that's more whole to the people, to the clients. It's not just getting massage alone, it's not food, your emotion and all that come into play. I truly believe that. Yeah.
Well, I found a long time ago in my career that until I addressed whatever the underlying issue was, especially if it was emotional, until that person started to talk about that, the tissue wouldn't release, which I thought was really interesting.
Because the muscles hold that memory of emotional pain.
Yeah, all kinds of stuff.
Okay.
It's strange. The
Oh my
body's so
God.
mysterious. Like
Yes.
I had a girl who came in. She's actually one of my friends, and she came in. Every time she talked about the thing that was stressing her out, her neck tightened up. And because I kept poking, because I'll talk and I'll talk and I'll talk. I'm like, so what's stressing you out lately? Like, what's bothering you? And and every time, I forgot what it was. I think it was work or something. And every time she would talk about it, like, her neck would tense up. And then because her neck tensed up, I said, you need to deal with this issue. And that, I don't tell people what to do often, but I told her, I was like, you need to deal with this, because like this is what's causing your neck pain. So if you want to get rid of this, I would address the problem you're having at work. And she did.
Wow.
And like, then she came back the next week and her neck just completely released. And I was like, wow, that's cool. And that was like kind of the first time I recognized that, because I pay attention to what people are doing. And it's funny. I'm not doing anything that special. Like I'm just paying
No,
attention.
you do. You're the kind of person that have noticed that very detail. You pay attention. You tend to observe a lot. And you have that curiosity that you tend to like dig deep or ask questions, that makes I remember you were like, I mean, honor student, in when you were graduating. I was like, my God, he was so young. I said he was so young, but he's just so smart. He's like, a lot beyond average people because of how your mind operates.
Oh, thanks.
You
Don't
dig
ask
deep.
me to, don't ask me like geography questions.
Well, you gotta tap into that if you have interest. Anyway, Travis, thank you so much, so much. We'll come back again to talk about another topic,
Sure. Okay, I'm
and
looking
all that.
forward to it.
Yeah, looking forward to. Well, guys, thank you so much for tuning in. Please do not forget to subscribe. Share this video if you feel like it can help, some of your friends and your family, because it can be very useful. And Travis is going to come back and talk about another subject, perhaps, in nutrition or in some of the stuff that he discovered in healing people. Look him up, email him for facial reading, or you can take some classes with him. You can connect with him and see what classes he has to offer, because I think he can offer a lot of stuff that can be powerful to your journey. If you are a therapist already, hey, hit him up to see what else you can learn from him especially about the the energy meridian points on the muscles. That is very unique. That you will be teaching that, right, Travis?
Yeah, but yeah, sure. I'll be talking about that for sure.
I'm making him do that. All right, guys. Thank you for tuning in. Until the next video. Travis, thank you so much. And I'll talk to you later.
Yeah, talk to you later. Bye-bye.
Bye, guys. Bye-bye. Thank you.